6 warning signs of colon cancer. Colorectal cancer is one of the most common cancers diagnosed in the United States. According to the American Cancer Society, about 150,000 new cases are diagnosed each year. It is the second leading cause of cancer death, accounting for more than 50,000 deaths each year. The good news is that most colorectal cancers are preventable, and early detection greatly increases the chances of successful treatment. So it's important to be aware of the warning signs so you can seek medical attention right away. In this video, we will discuss 6 warning signs of colon cancer. Keep watching. No. 1. A change in bowel habits. When it comes to your digestive system, it's important to pay attention to any changes in your bowel habits. This includes both your stool and how often you have it. According to the National Institute of Diabetes and Digestive and Kidney Diseases, a change in bowel habits is a common symptom of colorectal cancer. Specifically, the following changes may be warning signs. A persistent change to your bowel habits, such as diarrhea or constipation. This lasts for more than a few days. A change in the consistency of your stool, such as finding blood in your stool, or finding that your stool has become narrower than usual. Less commonly, a noticeable lump or mass in your rectum. If you experience any of these symptoms, it's important to see your doctor. Although these symptoms can be caused by less serious conditions, they can also be an indication of something more serious. So it's always best to err on the side of caution. No. 2. Abdominal pain and bloating. Abdominal pain and bloating are other potential warning signs of colon cancer. This is because as the tumor grows, it can cause a feeling of fullness or bloating. Additionally, if the tumor is located in the lower part of the colon, it may cause pain when you have bowel movements. However, it's important to note that abdominal pain and bloating can be caused by a variety of factors, including gas, indigestion, and constipation. So while these symptoms may be concerning, they're not necessarily a cause for alarm. No. 3. Unexplained weight loss. Another possible warning sign of colon cancer is unexplained weight loss. In fact, weight loss is the most common symptom reported by people with colorectal cancer at the time of diagnosis. When cancer cells grow and divide, they require a lot of energy to do so. As a result, they begin to take nutrients from the surrounding tissues, which can lead to weight loss over time. If you notice that you've lost a significant amount of weight without changing your diet or exercise habits, it's important to talk to your doctor. A weight loss can be caused by a number of different factors. It can also be an indication that something more serious is going on. No. For weakness and fatigue. If you're constantly feeling tired or fatigued, it could be a sign of colon cancer. This is because fatigue is a common symptom of many different types of cancer. As colon cancer progresses, it can cause a number of other symptoms that can contribute to fatigue, such as anemia, malnutrition, and depression. However, it's important to note that fatigue can also be caused by a variety of other factors, such as stress, lack of sleep, and certain medical conditions. So while persistent fatigue isn't necessarily a cause for alarm, it's still important to see your doctor to rule out any underlying issues. No. 5. Rectal bleeding. Rectal bleeding is another possible warning sign of colon cancer. This is because as the cancer grows, it can cause ulcers or sores in the lining of the rectum. These ulcers can then bleed, causing the symptoms. However, it's important to note that rectal bleeding can be caused by a variety of other factors, such as hemorrhoids, which are swollen veins in the anus and rectum. If you notice that you have blood in your stool or on your toilet paper, it's important to see your doctor. While this symptom may be alarming, it's important to remember that there are many different causes of rectal bleeding, and the majority of them are not serious. No. 6. Changes in urine. Although this may sound surprising, changes in urine can actually be a warning sign of colon cancer. This is because as the cancer grows, it can cause a blockage in the colon. This blockage can then cause urine to back up into the bladder, leading to changes in urination. Specifically, you may notice that you have difficulty urinating, a burning sensation when you urinate, or a cloudy or bloody urine. However, it's important to note that changes in urination can be caused by a variety of other factors, such as a urinary tract infection. So while any changes in urination should be checked out by a doctor, it's not necessarily a cause for alarm. If you notice any of these warning signs, it's important to see your doctor right away. Early detection and treatment of colon cancer can greatly improve your chances of a positive outcome. Don't wait. Schedule an appointment with your doctor today. Thank you for watching and stay healthy.